I'm the CEO of the Asthma Society of Ireland, and I also have asthma myself. And I'm here with Eleanor Jonathan, and I'll let her introduce herself to you.
Hi, my name is Eleanor. I'm a Professor of Respiratory Medicine here at St Vincent's Hospital, and I'm very pleased to be here talking about spacer devices today with Sarah.
So just to explain to everybody, we've been running a campaign over the course of the last few weeks all about spacers. It's called The Mystery of Spacers. You can possibly see it there on the screen in the corner. And the idea basically is we felt when we were talking to patients that there was a huge amount of patients who didn't really know or understand why it is that they should be using a spacer device. And there were a lot of kind of myths and misconceptions about why a spacer device is useful and helpful. So we've been very kindly supported by Teva in this campaign, and they've given us some support to make sure that we have all of the materials available to people so that they know what they should do about spacers. So there's a few things that I'll mention at the top, and we'll probably reference them throughout. We have a full spacer page on our website. At the moment it's part of the splash part of the homepage, and you'll see it there with the mystery logo, but it's there on the website all of the time, and it has a huge amount of information about how to use a spacer and when and why it's important. But we also have a video for every different spacer device where a nurse demonstrates how to use all of them. The second thing we'll have is, this is going out now as Facebook Live, but we'll be saving the video and we'll be sharing it with people afterwards, so you can feel free to listen to this anytime you want to. And I suppose the third piece is, aside from actually having the video pages there on the Asthma Society website, we also have the text which explains the different ways that you take them and has all of the most commonly asked questions there for people to use at any stage. So hopefully those will be of use to you, and come back to us and let us know if there's any gaps in any of that, because we just really want to make sure that people know as much as they can about spacer devices. And maybe just to explain one of the pieces that we've done as part of this campaign is we have done a survey of members of the public to ascertain what they know about spacers or what they don't know, and how they feel about them, why they think they're important. We had 2,318 people respond in Ireland to the survey, which is a brilliant response. And so actually, as we're going, we'll talk a little bit about what the survey showed. And one of the good things is that actually most people knew that it was about medication delivery, getting the medication right down into your lungs so that you get the best impact of taking your inhaler. So that was a really good thing. The second thing that's good is that people did understand that there are circumstances where you should need to use your spacer, and I suppose what it did show then was that there was a bit of confusion and kind of general relying on the myth in terms of who should use a device and why. So from my own point of view, as an asthmatic, when I was a teenager, one of the kids who was in my class had a spacer device, but she told me with total certainty that the only people who had to take spacer devices were people like her who had very severe asthma. So for me, for a very long time, I thought they were only for a very specific subset of people with asthma, and I would say that maybe our survey kind of indicated the same thing, that people aren't fully across that. In some of the things, for example, that showed up would be people thought they were only for kids. People thought they were only for emergencies or for people with severe asthma, that people thought nebulizers were more effective than a spacer and inhaler if you were treating an asthma attack. One of the weird things is that everybody thought that, or a lot of parents thought that their kids used it every single time they used their inhaler, but at the same time, when we were kind of asking more detailed questions, we discovered that they didn't actually have an inhaler or a spacer device with their child in school. And then a huge amount of embarrassment. So if it was parents or kids or adults, people seemed to be quite embarrassed about using their spacer device in public, in school, in work, or before taking exercise. So all of those we hope to kind of deal with in the course of the next few minutes. And we've had a lot of questions in over the course of the last 2 weeks, and just to say thanks for your engagement on that. We're going to answer those as we go, whatever ones we've had in advance. And then at the end, if you're answering any while we're live on air, we'll deal with all of those together at the end. So maybe, I suppose, if we want to kick off with some of the most basic questions about what spacers are, Eleanor, I think we have a question in from Sabrina. So there's 3 parts to the question, but they're really good and they're really upfront. She's asking, what is a spacer? Are you supposed to use it with all inhalers or just some of them? And what are the positives or negatives about using a spacer?
Okay, so a spacer essentially is any type of plastic tube that you can attach your inhaler to, and it holds the medication in suspension until you're ready to take a breath in. So really it's a device that sort of buys you a little time so that you can empty your lungs and then make sure that the medication goes right down into the lungs, because essentially an inhaler is a very difficult thing to use. It comes out really very fast, and it's very hard to kind of coordinate that with your breath. But the spacer device really just allows you to take the medication more slowly and makes sure that the medication gets to the right place. So positives and negatives. I mean, I suppose I mentioned some of the positives there, is that it sort of slows everything down so that when you have the medication loaded in the inhaler, you can take a slow breath, either one slow breath or maybe 5 slow breaths in and out, and it just allows the medication to get around that angle down into the lungs where you actually need the medication to work. When you're not using a spacer, often a lot of the medication gets sort of hits the back of the throat, the vocal cords, so you're not getting it to the area that it needs to be, and also then you may get some side effects from having the medication sort of coating the back of the mouth. So I say that there are a lot of the positives, and we may even come across some more over the next few questions. In terms of negatives, there aren't that many really with it. You do have to take care of it, wash it, replace it, and we'll be going through that in some of our later questions. And really, it's a medication that can benefit anyone with asthma, so you should really have it with you when you need it.
Okay.
And then of course it's maybe a little bit bulkier than just taking the inhaler around with you, but the benefits I think outweigh some of these sort of negative effects.
It sounds a bit like a no-brainer.
It is really, yeah.
And then, so just maybe to touch on one of the other questions that Sabrina asked is, are there different kinds, and what difference does that make?
So there are quite a number of different kinds. A lot of them look like this, or smaller versions of this with maybe a mask instead of a mouthpiece, and the mask is very useful for kids, particularly kind of under the age of 5, but there's no real cutoff for when somebody can move from the mask to the mouthpiece. It really just depends on the child themselves, and once they're able to put their mouth around the mouthpiece, they can move from the mask to the mouth, from the mask to the mouthpiece. You have other ones that look larger like this, and essentially they do exactly the same thing. You've got your mouthpiece, you've got the area where the inhaler goes in. The only real, one of the differences is, I suppose, that this device has a very specific shape. So it'll really only fit inhalers that have the same shape. So it's kind of an elliptical shape. So it fits in very well. Now, some inhalers have round mouthpieces, and that's not really going to work with this. Whereas something like an inhaler here that has a rubber end, that'll usually take both types, and it'll fit quite well, whether it's a round inhaler or an elliptical inhaler.
And are there some devices that you don't need a spacer for?
Well, there's some devices that just...
Or some inhalers, I mean.
Some inhalers. There's some inhalers, like this is a puffer inhaler, so one of the ones that you shake and you can hear the liquid in it. So this is a liquid inhaler. A lot of inhalers are dry powder inhalers, and they won't work for this type of device. So an inhaler that you don't have to sort of shake and depress won't work in this, because it relies on holding the liquid medication in suspension.
So if somebody is taking their inhaler, as standard, and they realise, I don't have a spacer, the next time they're going to their GP or their pharmacist, they can just check and see, should I also be using a spacer? Yeah,
exactly. And as I said, I think really all people who have asthma can benefit from using a spacer device. The spacer device is most useful, of course, for taking an inhaled steroid. So that's typically your brown inhaler. Because the inhaled steroid is one that you definitely need to get to the lungs, and there can be more side effects with getting that coating the back of your mouth. So you can get hoarseness or thrush or a sore throat from the steroid depositing in the back of the mouth. So that's why it's particularly useful to use this kind of device with an inhaled steroid. But of course you can use it even with just your reliever inhaler as well.
I think there's a really famous image that I've seen online that somebody had done of the actual the drug delivery of the lungs with a spacer and without a spacer, and it just really showed, you could actually visually see it. It's worth googling for people to see, just write down how deep the spacer helps the medication to go, which is really great.
Because you really do have to imagine that the medication that you're breathing in has to really go around almost a 90-degree angle to get down into the lungs where you want it. So, I mean, we have a lot of videos on your website which are very useful for showing how to use each of the different devices. But I think the important thing is that you still, when you use this, you should try and, if you can, hold your breath to give the medication time to get down. If you're doing a single breath technique, if you're doing the slow 5 breaths in and out, then the medication will get sort of pushed down with each breath.
Okay.
And I mean, these are great little devices. They have a valve here, so if you're a parent using this, you can see this valve flap in and out, and so then you know your child is breathing it in and out. And it also, some of the devices, particularly this one, has a whistle at the end, because the key is you want to take the medication in slowly, and if you take a breath too quickly, this will whistle and it'll tell you need to slow your breathing down. So they're quite good at teaching you how to take your inhalers even better and get the drug where it needs to go.
Okay, that's great, because Louise had actually asked us a question. She wanted to know about the range of spacers that were available and how effective they are. So actually, I think that probably answers those questions. It sounds like they're really helpful and can really help you. What we might do is just touch a little bit then on some of the questions we got about kids and spacers, because we had quite a few questions in that respect. And one question we got through from a parent on Facebook Messenger said, my son is 16 and uses inhalers. Should he be using a spacer to get more benefit from the inhalers? I know he has one, but he doesn't use it. So that's I think a useful question, Eleanor.
Yeah, I think it's particularly useful in the teenage years. It's useful for people from all ages, from like very young children all the way up to adults. But particularly in the teenage years, it's so easy to even forget a dose. Although we would recommend not forgetting doses, but you definitely want to make sure when you're taking the inhaler you're getting as much of that medication in as possible. So just as I said before, you will get more of the medication to the airways if you take the spacer device. You'll get less side effects from the medication coating areas that it's not supposed to be at. So it's more cost effective because you're getting the medication, and it's safer really from a side effect perspective.
Okay.
So I think it would definitely be worth him using it.
Okay.
Yeah.
Maria sent us a message saying, what age should the space be used up to with the spacer? She said her 3-year-old doesn't like using the mask, and she also asked, is it normal when taking a dose, and she's just indicated that she thinks that's in relation to Becatide, for them to cough with the first inhalation of every dose? We might take the first one there about the mask, I think.
Okay, so they recommend that the spacer devices with the masks are usually used up to the age of about 5 years, but that's not a hard cutoff. As long as a child is able to just put their lips around the mouthpiece, whichever device you're going to use, then they're old enough to use one of the sort of more adult type of inhalers. And there's even different sort of gradations of that. So her 3-year-old might be perfectly able to use it, but she would want to, I suppose, supervise her child just to make sure that things are working out okay. It's probably best with children that you do supervise the inhalers to make sure they're getting it.
Okay, and they need to be able to get a good seal around the mouthpiece.
Exactly, yeah, and you'll be able to. So they can completely seal the mouthpiece, and the valve means that when they blow out, like they can still exhale, but when they inhale, all they're going to be getting is the medication.
Okay.
Yeah.
I mean, I know we only have 2 of the devices here today, but
yeah,
there are a lot more on the market. There's
plenty.
more that people might see in the pharmacy,
Exactly.
and there's more coming on the market. But we have the videos for all of them on our website. If you need to have a look. Okay. Sandra has said that her daughter, who's 10, uses a spacer, but she's wondering how often it needs to be cleaned or replaced. And actually, that's a great question because that's something that had cropped up a lot.
Brilliant. Yeah, it's a great question. So it really depends on how frequently you're using the spacer device. If you're using your spacer daily, you'd really want to be washing this once a week. Now, if you're somebody who uses it more during like acute exacerbation or a flare of your asthma or an asthma attack, then it could be, I suppose, once a month. But we usually recommend once a week, and you'll know yourself that if it's looking a little worse for wear, that it's time for a wash.
Okay. Actually, interestingly, our survey showed that only 1 in 3 people who responded to the survey clean their spacer device as often as they should. So that's quite interesting in that that's obviously a kind of a gap in people's knowledge on that one.
Yeah.
And then Jessica was asking, and I think actually this might reflect another question we've gotten later on as well. Jessica and Karen had both asked about what age children should use the spacer up until. Karen was asking in relation to her daughter who's 9, and Jessica hasn't given us any details as to what age her child is. But I suppose it's interesting in that cut-off point is a kind of a myth that's there.
Exactly. People are saying now, when have they reached the state at which they can just take the inhaler without any spacer device? But we would always say there is really no cutoff. There's no age at which you won't benefit from using a spacer device, because you'll just get more of the medication where it needs to go. Okay. I just noticed, sorry, there was a part of Sandra's question I just missed. How often does this need to be replaced?
Yeah.
So we would say annually, usually you would want to replace it. You may even want to replace it sooner than that, again, if it's looking a little worse for it, but at least annually should be fine.
Right.
Yeah.
And that, I guess, depends on the user as well. I mean, if it's one that you're carrying in your bag with you everywhere and it's in a school bag and it's getting a bit bashed, then you need to check in. I think some of the manufacturers would indicate that some of them need to be replaced every 6 months, and others might indicate every 2 years. So it's probably just worth people having a quick glance at the little paper piece of recommendations that comes, the instruction piece, when they buy it, just to kind of have that in their head. Evelyn said to us that her son is 16 and uses inhalers. She's wondering if he should be using a spacer to get more benefit from the inhalers. So I think actually that probably isn't that far away from the first question we had, really. And then Sarah has said that her son and daughter use a spacer. She often worries that they're losing some of the medication through any gaps in the spacer itself, or by not ensuring that their mouths are fully sealed around the mouthpiece. And that the medication is not being all inhaled as a result. Sometimes she gives them an extra puff as she feels they've lost some in the breathing. She's wondering, should she or should she not be doing this?
Okay, that's a great question, because the devices are designed to have some of those spaces there, and that's just really to allow you to exhale. So those any of the, you can't really see them, but beyond the mouthpiece there are some little holes that allow you to exhale. And it's the same with this medication. So you even with a good mouth seal, there should be some holes around here. You really aren't losing any of the medication significantly through one of these devices, unless the device is faulty and needs to be replaced. So I wouldn't worry about losing any of the medication. So I probably wouldn't give more than is prescribed.
Okay. What might be of more value might be to do the kind of revision piece with the inhaler technique videos.
Exactly. If you're not sure, have a little look at one of the videos for whatever device you're using.
Okay.
And it'll show you how to use it correctly.
Okay. Anita says her little boy is 3 and he uses the yellow spacer, but she's wondering should she be changing it for a different one.
So I believe the yellow spacer is one of the pediatric spacers with a mask. So I think this is again the question of when do you move from the mask inhaler to, say, the green inhaler, the sort of next size up. And really it just depends again on the particular child. But you may want to use the mask up to about 5 years is fine. The yellow inhaler or the yellow device.
And Melanie says her son is nearly 7 and uses a spacer. She's asked what age should he go on to the next device. Now it's a little bit hard to answer that because we don't know what device he's using at the moment. She hasn't indicated that.
I think I could be incorrect, but I think she's again asking, when does he need to stop using the spacer and move on just to say
the inhaler on his own
potentially. And as we said, he should continue to use an inhaler or a spacer device.
Okay, so one of the next sets of questions then was just about general space or spacer upkeep. One lady has come back to us and has said that her daughter, who's 10, uses spacer. She's wondering how often it needs to be cleaned or replaced. So I think we touched on that a little bit.
Exactly.
In that the replacement piece depends on the device and people should check in, but in general, annually is a good rule. And then
they also,
cleaning.
Exactly. I suppose they also, with each of the devices, they also give instructions as well. So they'll also say for a particular device, if it needs to be replaced more frequently, it'll be in instructions as well.
And I do think that one of the points one of our nurses had reverted back on is, as well as cleaning it weekly, if a person has had a chest infection, they should clean the spacer device at that point, because obviously you just want to make sure that it's clean and sanitary and there's no trace of the infection still in the device. So probably a helpful one. And I know Emer and Lynn had also asked us about the best way to clean the spacer and how often.
So this is a really great question. So the best way to clean the inhaler is to use sort of a soft, like a mild detergent, and you can either just leave it to soak. You just pop it in a basin. You can take them apart as well, which is quite useful. This rubber end will also come off, but pop them into a basin for about 15 minutes, and then just take them out and let them air dry. You don't really want to be getting at them with a scrubbing brush.
Okay.
You don't want to be wiping them dry with cloths. You just want to let them air dry. And even if there's a bit of detergent on, that's not a problem. Because what you want to avoid is you want to avoid generating static inside the device. Because then once you use your inhaler, all of the medication will stick at the side and not get to where it needs to go. So some of the devices are also machine washable. I think this one is machine washable. It'll say on the instructions of the particular device whether you can put it into the dishwasher. When you want to dry it, just on the drying rack, let it air dry.
Okay.
Some people will have more than one device, more than one spacer device, so that they can always have one sort of cleaning and have a spare one. You know, that if they're using this device every day, they might have a second one as well.
And Maria had come back to us and said she does a lot of running, and recently at a race she went to one of the ambulances who were available for first aid, and she was quite surprised to learn that they didn't have spacers on board the ambulance, and she was wondering why this is. So actually I think this kind of relates into one of the interesting points from our survey, which was when we asked people, like when you've gone to an ambulance to your GP surgery or to hospital, how has, you know, if in the event of having an asthma attack, how has that been treated? And there was a variance. So some people have been treated with an inhaler alone, some with an inhaler and a spacer, and some with a nebulizer. And so I think that might relate to Maria's question. And interestingly, one of the things that we found, and I think it's probably something you'd want to touch on, Eleanor, is that people felt that the nebulizer was the best treatment option, whereas I think actually it might reflect the fact that you're treated that way in hospital or in an ambulance situation. It might reflect the fact that actually a spacer is single use and you can't actually use it multiple times for multiple patients, whereas you can do that once you kind of change some elements of the nebulizer, and that's why you might have a different treatment available, I suppose.
Yeah, you're very right. So especially in GP surgeries, but also possibly in St. John's Ambulance, they may have a nebulizer as their sort of first line treatment for somebody who has an asthma attack, because a lot of the tubing and the mask is disposable, one use, whereas this would be specific for an individual person. And I think a common misconception has grown because of this, that when you're having an asthma attack you need to have a nebulizer. But in fact, using your regular inhaler, your reliever inhaler, with a spacer device is just as effective as a nebulizer. Okay. Especially if you apply the 5-step rule in the situation of an attack, which again is on your website. If you're feeling very short of breath, often the slow breaths in and out rather than the one sort of single breath technique might be more appropriate, but the medication will get down to the airways just the same as a nebulizer.
Okay,
yeah,
that's great for people to know that, I think. And then we had a few questions about the practicalities. So actually in both instances they related to handbags, so thank you for your handbag related questions. So one lady which had come through on Facebook had been asking, is there an adult spacer that would fit in a handbag? She felt she can't carry the Volumatic, which is the larger one that you see here in front of you, because it's too bulky, and she felt she really needed her inhaler today because she was finding the cold had been really getting to her. Or Josephine had come back and asked again, she felt that the spacer is hard to manage in her handbag and that her handbag is getting ever bigger, and so she was really wondering if there's an option on that front.
Yeah, so I mean both of these devices will work the same way. But obviously, like a smaller device, such as an aero chamber, will fit much better in your handbag. Of course, this device can, you can take it apart and still potentially bring it around with you. But as with all sorts of devices, you kind of again want to avoid too much static. You really wouldn't want to be kind of carrying these around in a plastic bag, because that could generate some static. But the small device such as this would be fine for a handbag, and it's as small as we can really get them.
So I suppose the recommendation there is, if people feel that maybe what they have been using hasn't been as practical as they like, to have a chat with their GP the next time they go in, or to have a chat with the pharmacist, and just to get a little bit of advice as to whether there's a different option available to them.
Exactly, and I believe you also have quite a sort of selection on the website as well, so people can even have a little look themselves. And sort of
so we retail the spacer devices ourselves on the website. People can have a look there, and make sure you log in if you're a member already, because you get a discount if you're a member, and that can make buying a device just that little bit more manageable financially. So I think that might be all of the questions that we had gotten in advance, but I'm just wondering if any questions are coming around the air. Or?
We had 2 questions, but you've actually answered both of them already, so that's great.
Okay,
yeah.
so 2 questions that have come in, but we've answered both of them already.
Great.
I can check in with Eleanor in the next day or 2, so if any questions come in after the fact, and if they haven't been answered over the course of the broadcast, we can just pop those in as a comment alongside the event. But I suppose maybe 1 or 2 of the things that I might like to kind of close out on related to some of the stats that came back in the survey. I mean, 48% of people who had responded to the survey who had asthma themselves hadn't used their spacer in the last year or had never used one, which to me says really that we just need to get the message out there that these are great for avoiding any side effects with your medication, and are also really important for the most accurate drug delivery that, as you say, Eleanor, gives you the best impact and really gives you the chance to have your best, most healthy day, I suppose. And the second piece that worries me and kind of crops up consistently when we talk to members is that 41% of people with asthma didn't visit their GP after an asthma attack. And I just really kind of want us to reiterate how serious an asthma attack is. It's an indication that your asthma is really not in control. And in the same way that we would ask somebody if they had a stroke or a TIA or a heart attack or a heart event, that they will go to their GP afterwards, please go to a GP if you have had an asthma attack, because there's a huge amount that can be done to get your asthma in control and give you a much better quality of life, and make sure that you're avoiding A, what is a frightening experience, and B, what can be a potentially fatal experience. And I'm sure you back me up on that one.
Oh, I did, 100%.
Okay, and then I suppose the last bit is just in terms of the survey piece. I mean, 1 in 5 people believed that spacers were for children only, and spacers aren't for children. I think we've kind of reiterated that as we go, but we'd really welcome any more questions that you have in the next few days. We'll have a press release with all of the results of the survey in it, which is a good opportunity for us to correct some of the erroneous information that's out there, so we're looking forward to getting that out. And if people have any other questions about spacers, please do come back to us, because we want to make sure that our page on the website on asthma.ie is as up to date as possible, and that'll be there evergreen. Even if we have a new campaign we're talking about in the next month or 2, and that page will still be on the website, so all you have to do is search in the search box for spacers and it'll pop up. And thanks for joining us. Okay, bye.
Bye.